Okay, imagine a disease that can act like a dozen others. One day it might show up as painful bumps on your skin. The next, it could be blurred vision. Its cause? A total mystery. And it can pop up in almost any organ in the body. Well, that's sarcoidosis. It's a true medical puzzle, so today let's dive in and see if we can put some of the pieces together.
So, what are we really talking about here? At its core, sarcoidosis is defined by two key things. First, its cause is, as we say in medicine, of unknown etiology, which is just a fancy way of saying we have no idea what starts it. And second, it's all about these things called non-caseating granulomas. Now, just think of these as tiny, organized clumps of inflammatory cells that the body builds. It's almost like it's creating these microscopic fortresses inside different organs. And these granulomas, they are the absolute hallmark of the disease.
Now, even though the cause is a mystery, we do see some patterns in who gets it. The condition tends to show up most often in young adults, and we also see it more frequently in people of African descent. To really wrap our heads around this, here's how we're going to break it down. First, we'll look at the two main ways this thing can present itself. Then, we'll cover the key signs doctors are looking for. After that, we'll get into a really curious biochemical clue, the calcium connection. And finally, we'll touch on some specific syndromes that are linked to the disease. All right, let's start with how this disease even shows up in the first place. You see, one of the things that makes sarcoidosis so tricky is that it doesn't just have one look. It really has two very different faces. And this slide really shows you that contrast perfectly. On one side, you've got the acute form, which can hit suddenly, almost out of nowhere. A person can develop erythema nodosum, these painful red bumps, usually on the shins, along with a high swinging fever and really sore joints. But on the other side, you have the insidious form. This is so different. It's a much slower, gradual creep. You might feel shortness of breath, what we call dyspnea, or have a nagging dry cough that just won't go away. Plus, a general feeling of being unwell or malaise, and maybe some unexplained weight loss. You can see how this makes getting a diagnosis incredibly challenging, right?
So whether it arrives with a bang or a whisper, doctors have to look for more specific signs to piece this whole diagnostic puzzle together. Let's dig into some of the most important clues.
The eyes are actually involved pretty often. A really common sign is something called uveitis, which is an inflammation of the uvea, that's the middle layer of your eye. For a patient, this might just feel like redness, pain, or blurry vision. But for a doctor, it's a huge clue that a systemic process, something like sarcoidosis, could be going on. The skin can also give us some major clues, and one of the most specific signs out there is a condition called lupus pernio. These are chronic, purplish, hardened patches of skin that you'll typically see on the nose, cheeks, or ears. And, while it's not the most common sign, when it does show up, it speaks volumes. So why does this one skin sign matter so much? Well, because it's a massive red flag. Its presence tells a doctor that the disease is probably chronic, not something that's just going to go away. It often points to a poorer prognosis and is frequently linked to problems in the lungs and airways. Seeing lupus pernio usually means the patient is going to need more aggressive, systemic therapy to manage the condition long-term. It's a real game changer. Okay, let's switch gears to one of the most unique, kind of strange features of this disease. Its relationship with calcium. So here's what happens. Remember those little granulomas we talked about? Well, the inflammatory cells inside them, specifically cells called macrophages, they just go into overdrive. They start converting vitamin D into its active form way too fast, at a totally unregulated rate. This creates a huge excess of active vitamin D, and that, in turn, tells the body to absorb way too much calcium from your food. The result is high calcium in the blood, a condition we call hypercalcemia. It's a fascinating little chain reaction. Sometimes the different signs and symptoms of sarcoidosis don't just appear randomly. They actually group together in these recognizable patterns, which we now call specific syndromes. First up is something called Lofgren syndrome. This is that acute, sudden onset version we mentioned earlier. It's defined by a very specific combo of symptoms: swollen lymph nodes in the chest, those painful red bumps on the shins, or erythema nodosum, fever, and joint pain. Now here's the crazy part. Despite how dramatic and awful it sounds, Lofgren syndrome usually carries an excellent prognosis. A lot of the time, it just resolves on its own. And then there's another pattern called Hereford's syndrome, which also goes by the name uveoparotid fever. This one is a really distinct trio of symptoms: swelling of the parotid glands, those are the big salivary glands in front of your ears, fever, and that eye inflammation, uveitis, that we talked about before. So, from its sudden arrival in one person to its slow, quiet creep in another, From signs on the skin to the chemistry of the blood, sarcoidosis is truly a single disease with so many different faces. And that leaves us right back at the central question. With its cause still a complete mystery, what do you think will be the next big clue in finally solving the puzzle of sarcoidosis?